warm welcome to you from Geneva, Switzerland. I'm Reza Sadki, live from the Geneva Learning Foundation. Today we are doing our first COVID-19 daily bulletin. We're not quite sure how to call it yet, so help us figure that out. And we are going to today meet one of the amazing individuals who has joined the Peer Hub and who is going to share her experience with respect to the very specific concern that health workers have concerns about their own safety while conducting immunization sessions. So Adunola Abosede, well, a warm welcome to you, and very pleased to have you online with us. Could you introduce yourself to the participants?
Good evening, everybody. My name is Adunola Oyegoke. I'm a resident of the Nigerian Field Epidemiology and Laboratory Training Program. My field site is the Nigerian Center for Disease Control, and I'm happy to be here today.
Great.
On the program.
Thank you. So right now I just want to welcome those of you who are joining us on Facebook. And before we dive in, we're just going to, so first of all, for Salisu Yaou Suleiman, and who just says hi. Salisu, could you let us know what city and country you are connecting from? Just in addition to saying hello and hello back, also to Serge Tancoano. So please go ahead and type into the comments if you're watching on Facebook to let us know. So now a little bit about the Peer Hub. The Peer Hub is about supporting immunization staff, helping immunization staff help other immunization staff to share experience, spread good ideas and practices, and take action to keep vaccination going during the pandemic. So the applications to the Peer Hub are still currently open. They'll be accepted until the evening of the 26th of July, so you have less than 5 days left to apply. What does the Peer Hub offer? So if you are immunization staff working at either national or subnational level, the idea is to connect with other professionals, share ideas, and support your action planning and support the work that you are doing, the critical work that you are doing to maintain services, to help recover services, to help restart campaigns. And it is very much about being very practical and hands-on. So we know that you are short on time. So back to our guest, Adunola Abosede. So could you tell us when you first realized that health workers had concerns about their own safety while conducting immunization sessions due to in relation to the pandemic?
Okay, I was deployed to Oyo State, Nigeria, as part of the National Rapid Response Team from Nigeria Center for Disease Control to support the state in their response to the COVID-19 outbreak. So while in the state, we carried out some assessment of some of the health facilities in the state. And during our visit to one of the health centers, we interacted with the healthcare workers that were in charge of immunization at the health center. They now expressed concern about their safety because they didn't have inadequate knowledge about what COVID-19 is, and they were going with the news all the news in the media, where there are so many conflicting news in the media, things to generate fear. So they were afraid, they didn't know what to do, and they don't know whether the PPEs they had were enough to offer them the kind of protection they would need while carrying out their activities. So it was during one of such visits that we realized that quite a number of the health workers were actually concerned about their safety while carrying out their duties.
All right, thank you. I just want to acknowledge those of you who are joining on Facebook. So Halima Toro from Nigeria, Oumar Traoré, on a déjà fait le français, c'est à 13h heure de Genève. Just clarifying that the French version of this is at 1 p.m. Geneva time. Hello to Ebede Chinyere Blessing and to Jean-Claude Nti Rampeba. Shalini Kari from New Delhi, Ajoa Maria Pamfo from Ghana, Emmanuel Musa, who greets Shalini. I guess you know each other. It's wonderful to see scholars connecting in this way. So we know that you are short on time, and for this reason, these events, these live bulletins, the purpose is to share a very concrete idea or practice with you, for you to be able to ask your questions and to really hear the story firsthand as part of the activities of the COVID-19 Peer Hub. So Adunola Bosede, can you tell us what were the specific fears? What kinds of questions did you have to answer in response from immunization staff concerned about their own safety?
Thank you. The questions we had to answer were questions regarding how to use their PPEs, how to set up the flow in the health center for the mothers bringing their children in such a way as to protect the mothers from contacting COVID-19 if there's anyone that may have it among the visiting mothers, and how the health workers themselves can be protected while carrying this out, and how to understand the signs they need to watch out for to know who may be a likely case of COVID-19. So those were the questions that most of these health workers wanted to know about. And they were also concerned about what is being done by the government to ensure that they are actually safe and protected, and what provisions has been made to ensure that they have constant supply of the personal protective equipment while carrying out their activities. And then they were also concerned about their security, because there has been some news about with people having fears that they may be injected with COVID-19, or their children may be given the COVID-19 virus during the immunization activities by the health workers. So they were also concerned about how safe they are if people want to revolt to think that, oh, these health workers, they want to give our children the COVID-19. So they were also concerned about that and what is being done to ensure that they are safe and that the public knows that the vaccines are safe. So those were the questions.
Yes. Okay, thank you, Adunola. So your response was to develop training specifically for immunization staff. Can you tell me what did you aim to provide that would not have been provided in the past? What was different with the COVID-19 pandemic?
Okay, what was different was that our objective in training them was to ensure that they're able to integrate their services and not just focusing on just giving out the vaccines to the children, but also to be part of the COVID-19 response and to also protect themselves. So we trained them to carry out some surveillance activities and also to be used as agents for risk communication so that they can talk to the mothers on how to protect themselves from getting COVID-19. And also when they carry out the house-to-house visit, so that they can also watch out for cases. So we're using them to carry out active case search so that they can watch out for cases and see and be able to direct the people through the proper channels to which to notify the disease surveillance unit of cases that they may have come upon during their immunization activities.
So Adunola, you have given a very comprehensive list of issues that were addressed by this training. I did not hear anything specifically on the topic of the rumors, of the fears and the confusion that vaccines are somehow related to COVID-19. So first of all, let's be perfectly clear. There is no vaccine against coronavirus SARS-CoV-2 yet. And the current vaccine preventable diseases and the vaccines for them do not and cannot cause in any way, shape, or form be responsible for the COVID-19 disease. Was that part of the training in terms of both that information, but also how to convey that and how to communicate that to concerned caregivers or others?
Yes, that was part of the training. We actually had a module on the epidemiology of COVID-19, where we took them through what COVID-19 is, what the virus is, how people can contact the virus. And we also informed them that there is no vaccine against the COVID-19 and that vaccines are actually still very safe.
Right.
So any of the parents or caregivers bringing their children, there is no way that they can get COVID-19 from receiving the vaccines for their children. So
So
we
that,
actually had a whole module on
yeah,
that.
so that's a fact. You cannot get COVID-19 from taking an existing vaccine. But is the
Yes.
problem that people do not know that, or is it that immunization staff perhaps haven't developed the skills to communicate that effectively?
Yeah, part of the problem is that the immunization staff, their capacity was yet to be built to be able to communicate that effectively. And then because of the rumors and because of the fear amongst the public about the novel coronavirus. So I think that was what made it a bit difficult for them to be able to communicate that very well to the mothers and the caregivers. So I think that was one of the major issues because people, and then, in some of these communities, a lot of the people, they are unable to understand some of the messages that are not yet in their local languages. So they didn't have access to that information to know a lot about what COVID-19 is. So these health workers, we have to provide them with that information so that they can share it with the community in their local languages and in a way that it will be easy for them to understand.
Great. So what difference has this training made, and how do you know that?
Okay, the training has made a whole lot of difference because in the initial stage, when we started visiting those health facilities, the health workers were showing some reluctance in carrying out their duties. But after the training and after also helping them with rearranging the flow in the health facility and telling them ways to protect themselves, the time we visited them again post-training, we realized that they were more confident in carrying out their duties and they were more open to telling the caregivers about what COVID-19 is. And they also helped us in actually identifying cases from amongst those that were visiting the health facilities. They were able to help us identify COVID-19 cases, which were later investigated by the COVID-19 response team.
Great. So, has this training, have you been able to determine if and to what extent this training has made a difference in actually bringing back caregivers? And where are you currently on catch up? Are you also involved in those efforts, or has your role been to prepare the training and then that's your contribution?
Yeah, but my role has been to be part of the team that prepared the training, and we're trying to follow up on the progress that has been made so far since the training, but because of the conflicting activities that we have with the COVID-19, so that's still a work in progress. So we're still working on that, on getting
So
all
we
the
have a
information.
question from Jiking Lumba on Facebook. So he is in Yobe, Nigeria. It says most mothers are scared of taking the vaccine because they fear that most health workers have COVID-19. This makes them more scared. So if you how would your training, sort of help a health worker who has to communicate that the fact of working in a health facility with proper PPE, they're likely to be well protected from the coronavirus. Does your training address that? If so, how? And can you give us an example of, say, the key messages or the exact words that you encourage health workers to use to reassure their caregivers about the safety of coming for vaccines?
Yes, we had a module on infection prevention and control in the context of COVID-19. And this training, we were able to communicate to the health workers to let them know the mode of transmission of the COVID-19 virus, which we encourage them to communicate to the mother so that they will know that just by coming for the vaccination, they won't be exposed because the healthcare workers are using the right PPEs. They're using the PPEs the right way, and this is going to help with preventing the mothers from actually getting in contact with the virus, even if the healthcare worker is infected. And usually we also tell the health workers to also observe themselves. We encourage them to buy digital thermometers to monitor their temperature and watch out for signs and symptoms of COVID-19 so that in case they feel they may have, they can go into self-isolation and go for testing without having to go to work and expose people to it just in case they have it.
Great.
So we had a module on the IPC where we told them things to say to the mothers to reassure them that they can't get COVID-19 from just coming for the vaccination. And then we also helped with the organization of the flow of the caregivers and the clients at the health facility. So these arrangements, we put into consideration the IPC considerations that would help in preventing the COVID-19 from being transmitted within that health facility.
Great. All right. Thanks. Very clear. Adunola. So we have a quite a long comment from Ebede Chinyere Blessing. Thank you, Ebede. For this, it says there's a lot of myths and rumors surrounding COVID-19. We've had cases where some people send voice notes that people are being given injections that make them have COVID. So that is false information, fake news, if you will. So risk communication is important, but we need to start with rebuilding trust using the community structures and opinion leaders. Do you have any again, is it a problem of information or is it a problem of being able to effectively having sort of techniques and maybe even sort of negotiation techniques to engage with healthcare workers? Adunole Abosede, what would be your response or your comment to Ebede?
Okay, regarding that, apart from working with the health workers at the health facilities, we also carried out some community engagement where we involved the community leaders. And we use the healthcare workers in interacting with these community leaders because we know that the healthcare workers are trusted people in the community. So we use them to educate the community leaders so that they can talk to people in their community and allay their fears regarding the rumors. And we also provided them with IEC materials to address their concerns regarding the COVID-19 and the vaccines. So we were able to address some of those concerns. And we also had a risk communication pillar that was actually responsible for addressing issues regarding rumors and every other thing concerning COVID-19 that we're also working side by side with the rest of the team in the communities.
Justice Kofi Ntiamoa on Facebook says, I think that we should consider multiple outreaches to cover every child if we can have lots of emphasis and intensity on home visit activities. Let's see what else. We've had quite a few comments. I've been struggling to keep up. Thank you for being so prolific. And we really want these sessions to be interactive. Brajat Garg says, I think among caregivers, instead of elderly and vulnerable, other family members should be advised by healthcare workers to bring children. That sounds like an important point I had not heard mentioned elsewhere. Thank you, Rajat. Bunbida Mohammed says, a lot of community mobilization and sensitization needs to be done to improve coverage during COVID. So there's a lot of the statements like that, Bunbida Mohammed, that we can agree on. The real question and what we're trying to get at, and Adunola Abosede's practical, hands-on work to figure out, is about how do we do that. Everyone agrees we need to engage communities. Everyone is going to agree that we need to involve community and religious leaders. The question is how we do that effectively and on what basis. This is where I want to go back, in fact, to Adunola Abosede from Nigeria. She has developed a training program in response to health worker concerns about their own safety. So you mentioned that there was a part of the training involved that community engagement piece. Can you tell us what have you found to be effective in terms of what things a health worker can actually say and how to say them to reassure someone and to combat the fears and the rumors? It can't be as simple as telling someone, you cannot tell someone that they only believe such rumors because they are ignorant or because they don't have the information. They may be very respectable people with a certain level of power in the society. What is the right way in your experience to address, to sort of get at these issues without giving anything up, showing zero tolerance for something that is false, but also being sensitive that it's not just by telling people that something is false that you're going to change their mind?
Yes, the best way that we observed was that you need to actually gain the trust of the people. And after gaining their trust, you need to actually explain with evidence to them what you're talking about. If we're talking about how the disease is being transmitted, you actually tell them in a way they can understand, and you tell them in a way they can understand, and you explain to them how it is being transmitted. Some people might believe that, okay, maybe this you can get COVID-19 just if they touch you. You explain to them that, okay, this is actually the way COVID-19 is being transmitted. It's through droplet spread, and you explain to them what droplet spread is. By the time you break it down to them in simple terms that they can understand, I think the people, they feel better afterwards, than rather than speaking to them and just speaking the big English, the big terms that they're struggling to comprehend. So I think one of the things that was beneficial was breaking it down to them in a way they would understand, and actually showing them and visuals to assist their understanding of what the situation is. So that was one of the things we found very useful while training the health workers.
Thank you, Adunola. So we have also in our Zoom room here, in addition, so we're broadcasting on Facebook, and great to see so many comments. We have right now 109 people who are watching the live stream. We know many more will catch up. This is a very short session, and we know you are busy. We know you're short on time, so we really want to make this focused and practical. Sohini Sanyal is in the room with us. And Sohini, I'd like to ask you to share what you have already shared in the chat. I'm asking you to unmute. You said you saw a photo of a session in one of the northeastern hilly states of India. Can you tell me what you saw and how it relates to our discussion?
Yes. So this was a photo that I saw, which was shared on Twitter. And what happens is, usually in a lot of cases in the health facilities, the rooms are small. It can get crowded if there are a lot of people, which of course makes it worrying for the caregivers to come for vaccination. So here, what they did was they used the outdoor space, which is always available, but because summer months are quite hot here, it's rather uncomfortable. So I saw in the picture there were chairs. The chairs were set apart, quite far apart, and every chair had an umbrella attached to it. So that gave people shade. The caregivers could sit comfortably, and it was safe because there was enough space to have some kind of physical distancing. So such kind of little efforts which makes the community feel that they are able to go into a session site and still maintain physical distancing, which is very important to stay safe in COVID. I think these kind of little interventions can go a long way in convincing caregivers to come for vaccination.
Great, thank you, Sohini, for this very tangible example. I want to share, this is actually an important bit of news from Javed Iqbal, who says in southern Yemen, SIAs, so vaccination campaigns or supplementary immunization activities, have resumed with a diphtheria campaign conducted in 5 governorates targeting children 6 weeks to 14 years of age, after workers being trained on IPC and using appropriate personal protective equipment with a very good coverage. So that means most campaigns, when we surveyed in April and through the COVID-19 Peer Hub application, almost everyone said that vaccination campaigns were being suspended. So there are clear signs that under the conditions of a pandemic, some people in some countries are managing to restart campaigns. So I see more right now. We are down to 102 people in the room. Richard Tongo and Banda says, nice to be with you. Discussions about immunization in pandemic reality. Il y a une séance en français à 13h, heure de Genève, Richard. And let's see. Yeah, Oforchika says it's about using every available space inside and outside while maintaining social distancing. Now, we have a very long message from Justice Kofi Ntiamoa. I'm not sure if we're going to have time to read it all. Let me see if I can kind of survey it. There have been instances where community folks have not accessed services, especially when there is knowledge of infection among health staff in communities. It's imperative to communicate that infection among health staff, if recorded, are normal and expected because of a proximity and exposure in relation to providing services. That's, of course, there are also preventive measures, I would add, coordinating and providing accurate community feedback during engagement as part of risk communication can equip community folks. Thank you for that very detailed contribution. Now, this is only one of the activities of the Peer Hub. For those of you who have joined late, we are talking about the COVID-19 Peer Hub. So this is about sharing experience, spreading ideas and practices, the good ones, and taking action to keep vaccination going during the pandemic. So if you are immunization staff anywhere in the world, I encourage you to apply, and you want to figure out how to do better by being connected with others. And today we have Adunola Abosede, who is, let me just spotlight her video, who has been kindly sharing with us her experience of how to respond to health worker concerns about their own safety while conducting immunization sessions through training. Let's go to Martha. So let me ask Martha to unmute. Martha, you have shared, you said your comment was very important, as just highlighted, winning the trust of the community remains the key before anything else. Would love to hear if you're able to speak to us. I'm trying to unmute you so that you can share with us what actions have you done, and concretely, how have you done it to win the trust of the community? Martha, welcome.
Thank you, Reda. Hello, everyone. Okay, I insist that the trust, because we are on the front line and we have different scenarios. I think we have in one case in one health facility where a caregiver came with a baby, and one vial of DPT was opened for the children for that session. And that child, after some hours, had some severe adverse effect following immunization, and sorrowfully that child passed away. And so it was a whole rumor in the neighborhood, in the community. So really have to go back to build the trust of that community, so that, because there were that rumor of COVID vaccine, and we're saying that is the vaccine that has killed the child. So we had to bring the other children who came for that session, who had the vaccine from the same vial. So gradually, we had to build the trust of the community to tell them that it might be something else and not that vaccine.
So Martha, yeah, so can you give me an example of a concrete action you took to rebuild trust? What exactly did you actually carry out?
Okay, we have to invite the caregivers, we invite the community leaders for the area where those children were coming from. And we had to talk with them and then present some facts, like vaccination has been, this is the same vaccine that they have been using over the years, and it might just be something else. The reason with us and the sessions, they continue because of the way we talked with them, and they understood that there was nothing new except for the vaccine that have been over the years, and so they had to continue with the vaccination. The community leaders, who are the opinion leaders in the community, had to go back to the community and sensitize the community to continue with vaccination session.
Right. Thank you, Martha. So I want to go back. So we're going to close this first live daily bulletin, ideas bulletin. We're not sure, ideas live stream, really a stream of ideas coming your way and that you can contribute to as well. I have one last question for Adunola Abosede. So we heard that you explained how you developed training in response to health worker concerns about their own safety. What would you say, other than the fact that the pandemic was new, what would you say was the thing that you did most differently than from, IPC training of the past? And I think we may have lost, no, okay. Yeah. Adunola, go ahead, please. All right, I think we may have, okay, let me, just ask Adunola to unmute. Yes, go ahead, please. I hope you heard my question. Yep.
Yes, I had your question. So one of the things we did differently this time around was that there was focus on the IPC. We focused mostly on the transmission-based precaution for COVID-19. Usually when we do the IPC training, we do it broadly, but this time around, we put more focus on the transmission-based precautions for COVID-19, and also to find ways that the healthcare workers, even if they do not have the standard PPEs, how they themselves can protect themselves and find ways to prevent themselves from being exposed to contacting the COVID-19, and also how to protect the mothers. And we also encourage them to train the caregivers when they come to wash their hands properly. So, and quite a number of the health facilities had this pedal operated hand hygiene station that they use before the caregivers will come in. So when they come in, one of the health workers will position themselves at the entrance and direct the mothers to go and wash their hands before now coming into the waiting area before they commence the immunization session. So that was one of the things that we encourage them to do differently.
Great. Thank you so much, Adunola Abosede from Nigeria. We are out of time, but this is only the very first ideas live stream. So a stream of ideas coming your way if you're immunization staff to share experience, spread ideas, and take action to keep vaccination going during the pandemic. So you have another, if you'd like to be part of this, Beyond will be doing many public facing events, but we'll also have a lot of internal discussions, private discussions between immunization professionals. If you'd like to be part of that, you'll need to apply if you haven't already before the 26th of July. So you have a little bit over 5 days and less than 6 to do so. Thank you so much for the 86 thumbs up. We had over 130 people attend today. This is just the first one. So please share with your colleagues. It's 30 minutes. We hope you got something concrete and practical thanks to the experience shared by Adunola Abosede. I'd like to thank the Geneva Learning Foundation team and especially Charlotte Mbu, who is preparing these events. Thank you so much, and look forward to seeing you tomorrow, same time, same place on our Digital Scholar Facebook page. See you soon.